Okay. Hello, everyone. So today, we've been talking a lot about, dental material that you would actually have to mix, meaning if it was a base or a liner or some type of cement material that we would have to use. So in this particular video, I wanted to show you how to mix RM and how it's actually placed inside of the tooth. So I'm going to go ahead and share that video with you. So just hold tight. Let me go ahead and get my screen going. So I'm going to make it big. Okay, so as you can see in this particular video, let me move this out you guys' way. In this particular video, you can actually see them placing the IRM. So of course, this is a molar. How I know that it's a molar, so we have one, let me pause it for a second. We have, let me get my pencil. So we have one canal here, two, and three. Those are your three canals. Okay, so only a molar, whether it's first, second, or third, is going to actually have three or more canals. Okay, if you pay attention to right here in the center, you can kind of see the nerve right there. So we definitely want to clean out all decay. And this patient could have possibly had a root canal. So we're going to actually seal off each canal. So this one is in the process of being sealed. This one is going to get sealed, and this one. And they're just placing a little form of IRM. So let me go ahead and get that video started. I'm going to erase all of this. Okay. There we go. Let me get the video started. Yeah, we can get started, right? Okay. Here we go. So as you can see, they mix the MRM and they're actually placing it in the canal, and they are going to use um, a probe of some sort to kind of pack that in the canal. And here we go. They're showing you, they're filling it, each canal. Here comes another picture, and they just showing you how the canal is actually filled. So when you look at this picture here, which is really clear, so we have this particular canal filled and this one filled also. So that way this patient doesn't have to worry about bacteria forming in the canal, having any sensitivity, things like that. Okay. Now here, this is pretty much, as you can see, the canal is filled. The canal is cleaned out. There's no decay. You can't even see the canal. You can just see inside of the occlusal area is pretty much being filled. All right. So I'm going to stop right there. And we're going to get into how to actually place a particular, not so much place, but show you exactly how to mix the actual material. Okay. So I'm going to definitely talk through the video. As you can see, this is IRM. Okay. So you see right here, pause, we have our glass slab. This is what we use in the lab. We have some 2x2 gauze. We have the liquid IRM, and then the assistant has the powder and a spatula with the scoop. So let's see how she's going to shake it up. She's going to take her scoop and put the powder on the slab. Now, I know you're probably thinking, how much of the powder do I actually need to use when mixing IRM? Well, that determines on the size of the tooth that you're working on. You know, your molars are bigger than all of the rest of the teeth. So if you have a really big hole that you're trying to fill in that tooth, you want to go ahead and make sure you maybe get 1 or 2 scoops of the powder. You don't need much of the liquid because you want the IRM to be not so tacky, sticky, but more like um, how when you chew a gum and the gum is like no flavor, it's rough, it's kind of hard, but it's still chewable. That's kind of how you want the IRM. So let's see. Okay, so she put 1 scoop, another scoop, and watch, put 1, 2. So you could say, give or take, you could say um, that this particular, with 2 scoops, we're gonna possibly put 2 drops. Here you want to kind of divide the powder into 3 or more individual parts. And the reason why you're going to divide it is because you want to make sure you're evenly mixing it in with the powder. And you see how we're kind of going in circular motions and we are mashing it in and gradually adding in powder. That is letting us know that, how much more powder we should add, and exactly how to mix it. So you want to kind of mash it towards that glass slab and add in powder as you go. And as you can see, it's starting to get thicker and not so wet anymore, because that's what we want. We don't want a tacky consistency. We want to be able to take that IRM and roll it up in a ball. And when we roll it up in that ball, it should not stick to the glove. You should be able to roll it up, kind of like your tacky material you use to hang a picture on the wall. It has to be that consistency. So she's mixing it, making sure we're getting all and any excess that's pretty much left behind, and just pretty much mixing it. So he's testing it, rolling it with her gloves, or he, I don't know if it's a guy or a female. So you see how that ball was formed? Let me kind of go back a little bit. You see how they were able to mix it evenly. And once you pretty much have that right consistency, you should be able to roll it up in a ball just like that. Okay? And that's pretty much it on when you are mixing an IRM. It's all about the right portions, how much liquid. You don't need a lot of liquid. You need a lot more powder than liquid. So you see 2 scoops, they had 2 drops, and that's pretty much what you would use to actually get that consistency. With that right consistency, you should be able to form a proper temporary cement to seat all crowns, any temporary material, anything to that nature that you would be doing for that particular procedure. Now, IRM can be a temporary material. It could be a temporary filling. It can act as a temporary cement. So we went over our crown and bridge tray. We went over amalgam tray. We went over our composite tray. We went over all those different trays, and we can use a form of IRM in those procedures as a temporary, remember, as a temporary filling or temporary cement. Okay. That concludes the session on IRM and how you actually mix it. I will be leaving questions on Edmodo, so be on the lookout for that. Until next time, I'll talk to you guys later.